Morning all, me again. I just thought I'd hop on this morning. We are 2 days away from surgery now. Um, Not gonna lie, I am very nervous now. I haven't really been up until this point, but I am very, very nervous now. I don't know why really. I think it's more so, it's not so much what's going to happen after and the big change to my life. It's more so the actual surgery itself and the general anaesthetic, I suppose, which is kind of normal, I would imagine, for somebody to feel quite nervous. I just wanted to hop on this morning. Just there's a lot of people that have been asking me sort of about what swayed my decision really in terms of having it done in the UK versus having it done in places like Turkey or abroad. Because obviously, as we all know, there's a huge reduction in cost to go abroad for surgery. However, it was very easy for me, really. I've been on this journey probably for about 2 years now in terms of researching, speaking to loads of different consultants, speaking to loads of different multidisciplinary medical teams on both sides of the pond, you know, here in the UK and also abroad. I actually have an underlying cardiological condition, which made me quite nervous anyway about going through surgery, but more so going abroad, because actually the companies and the surgical teams I was speaking to overseas didn't really seem to be bothered in regards to the cardiological condition, but actually the teams in the UK were, and they wanted to investigate whether surgery was a safe option and those sorts of things, because obviously the guidelines in the UK are very, very different. So that's kind of the main thing, because the companies I was speaking to, you know, in the likes of Turkey, etc., weren't really that bothered. So they weren't checking with, you know, a cardiologist or anything like that whether surgery was safe to go ahead. They were just saying, yes, let's take your deposit. So it made me nervous. And don't get me wrong, I paid deposits. I paid deposits to go to Turkey. It didn't go. You know, it's been a long, long journey of decision making and research for me, this. And then I actually thought the UK is the best option. Obviously, the cost of surgery in the UK varies from company to company, but for a gastric sleeve in the UK, it ranges between £10,000 and £15,000 for the procedure. However, I was very lucky in that there is only one private medical health insurance company in the UK that offers lifestyle surgery as part of their packages. I get private medical insurance through my employer with the job that I do with a company called Vitality Health. They are one of the, well, no, they're not one of, they are the only company in the UK that offer weight loss surgery or lifestyle surgery as part of the package. Obviously, the criteria is extremely strict. It's very similar to the NHS criteria, you know, where your BMI has to be above 40. You know, you've got to have, you know, tried a number of weight loss methods, including some of the new methods like Wegovy and Saxenda. You know, got to go through a full surgical consultation for the, you know, the surgeon to decide whether it's the right option for you, and then the surgeon makes that decision. If your claim is accepted then by the health insurance company, it's a co-payment arrangement. So they pay 75% of the cost and I had to pay 25%. So to all intents and purposes, it's cost me the same as it would have if I was going to Turkey, really, because I had to pay 25% of the cost, which is around about £3,000. However, the preoperative care has been second to none. I've had a multidisciplinary team. I've gone through things such as the surgical consultation with my surgeon. I've gone through a psychological assessment. I've gone through a dietetic assessment. I've gone through a physiological assessment. I've had my preoperative assessment with the nurses at the hospital, the private hospital where the surgery is taking place. So the barrage of care that's been provided even to this point has literally been second to none, I must admit. So yes, that's kind of been my process, I suppose, in terms of decision making. You know, I was very, very lucky to, you know, to find out about the Vitality Health insurance situation, you know, and it was, lo and behold, one of those things that I just already had through my employer and have had for many years. Never really used it because never had really any, you know, need to. But certainly has proved exceptional in this in this situation. So I've been very, very lucky actually in the fact that, I haven't really had to, pay or get finance for, the 10 to 15,000 pound for the procedure. Is kind of cost me the same as if I was going abroad, really. But I fully appreciate not everybody's in, in that same particular boat. But yeah, I just thought I'd do a long sort of video here, really, just to explain that, because there's loads of people that have asked me, kind of what swayed your decision. And I spoke to loads of different companies, all the companies you see on you guys' profiles in terms of who you've gone with in Turkey. I probably spoke to them all at some point, over the last 2 years, but my decision was swayed. It was either the case of I don't have this surgery done because I wasn't going abroad for it because I didn't feel comfortable, or it was the fact that I saved up for it a little bit, and it would have happened, in a couple of years' time, basically. But yeah, I've been very lucky now with this Vitality Health, and the wheels were in motion very, very quickly. That I first had my claim accepted back in April of this year, and obviously now we're in June and my surgery's taken place on Tuesday. And between now and then, I've had all my psychological, dietetic, physiological, surgical sort of assessments with separate consultants that have happened in that time. So yeah, that's my kind of story and explanation in terms of what was swayed there, really. So I appreciate this is a long video. I don't even know whether this will be able to go onto Instagram, actually. Who knows? We'll give it a try. But if anybody's got any other questions or queries, by all means, keep them coming. I'll still do these videos. I'll then hand this Instagram over to my partner to take care of whilst I'm in the hospital, because I really want to give a sort of warts and all sort of update, in terms of what's going on, even through my period of time in hospital as well. So I'll speak to you over the next couple of days. Thanks all.